The health and safety of the world's workforce attracts attention when industrial disasters, especially those resulting in the deaths of many workers, make global headlines. But the reality is that throughout the world, many thousands of people die from their work activities every day, and a great many fatalities go unreported or ignored.
The right to a healthy and safe workplace is a fundamental human right. Workers should not pay the price of production, but we all know that very often they do. And we also know that there is still a decent work deficit all over the world.
Since the financial crisis of 2008, austerity measures and deregulation policies in Europe have had a negative impact on working conditions.
The situation of more unemployment has created a situation of stress, for instance. This is not taken into consideration. Increasing inequalities strictly linked to the health of the workers. And these inequalities have reflections on the most vulnerable parts of the society. Trade unions have a platform of demands concerning occupational health and safety, beginning from a new attention on the new risks and the active involvement of workers in the representation of the health aspects in the workplace and in all the possible levels of bargaining.
In the maritime sector of Singapore, unions are working together with others active in this field at national and international levels to improve working conditions for seafarers.
Some of the occupational safety and health issues that they face could be fatigue. Fatigue that can be caused by many different factors that link together. So it could be watch keeping or overtime. It could be stress that come in as well, lack of sleep, especially you have to deal with weather. I think shipping is really very global, very international at the end of the day. So it is not just about my union, but working together in solidarity with the other organizations, other unions across the world. Together we develop certain areas like, for example, how to deal with fatigue, research on that, and how to come up with safety risk management and all the different aspects as well.
With over 1 billion people employed in agriculture, this sector is the second greatest source of employment worldwide after services. In terms of fatalities, injuries and work-related ill health, agriculture is one of the three most hazardous sectors of activity. The others are construction and mining.
El sector que tiene mayor problemática, que presenta mayor problemática, es el sector de plantaciones, porque realizan su trabajo en condiciones de intemperie, expuestos a la aplicación de agrotóxicos, y también son trabajos que se hacen en una superficie muchas veces irregular. De la insuficiencia renal crónica, muchos casos por cáncer en las zonas donde hay banano y piña, malformaciones congénitas también, y ese serie de problemas respiratorios y problemas también circulatorios que son provocados por la exposición a los agrotóxicos, no solamente de forma directa, sino de forma indirecta.
Health services are one of the fundamental sectors of society and the economy. The Ebola crisis in West Africa demonstrates clearly the threat posed to societies as a whole when quality public health systems are absent.
La santé et la sécurité en Guinée, dans le secteur public, est confrontée à d'énormes problèmes et défis. Premièrement, du fait que les dispositifs législatifs et réglementaires sont insuffisants, voire même mauvaises. Deuxièmement, du fait que les ressources humaines spécialisées dans le domaine de la santé et sécurité au lieu du travail est très faible par rapport aux besoins. Troisièmement, du fait que la prévention et le dépistage des risques professionnels n'existent presque pas.
Construction workers are 3 to 4 times more likely than other workers to die from accidents at work. Many more workers suffer and die from occupational diseases caused by exposure in the past to dangerous substances, such as asbestos.
Hazards and maybe the risk of fall can happen at any time for them. This industry is of tens of thousands, if not 100,000s of workers, although we don't have C-167 in a place here in Bahrain, and this is an opportunity for us to call for signing this contract.
What can be done to improve occupational safety and health worldwide? How can we ensure that the right to a healthy and safe workplace is exercised and enjoyed by all?
Well, prevention has always been the primary objective of occupational safety and health, and it's been a fundamental principle of the ILO since its foundation in 1919. But prevention, I think the focus on prevention is most important because it sends the clear message that accidents in workplaces and disease as a result of work are not inevitable, and they should not be tolerated. In fact, they should be prevented. I'm a very strong believer that you do not achieve compliance with occupational safety and health unless you have at the table all of the critical players, workers, employers, and the government, and only they together can then build the strategies that are necessary in order to ensure the safety and health of workers and their workplaces.
You know, union organizations make workplaces safer. All studies we know have shown that unionized workplaces protect workers' health by defending and improving health and safety standards. The ACTRAV, the ILO Bureau for Workers' Activities, stands ready to support unions in their activities related, among other issues, to the right to health and safety at work.